When you're on chemotherapy, you should ensure that you only eat cooked food. Vegetables and fruits have to be fully cooked or peeled. This is to minimize the risk of bacterial infections when your body is weaker than usual while on chemotherapy. If you are on specific drugs in the category of targeted therapy or immunotherapy, you might want to consult your doctor if there are more specific food prohibitions. A good example would be that you have to abstain from grapefruit if you are on a certain medication for lung cancer. We have tremendous advances, both for the chemotherapy and the medications that we use to minimize the risk of nausea and vomiting. So it is quite unlikely that you feel significant amounts of nausea or vomiting. There could be mild alterations in the appetite and the taste of food. One good way would actually be to use ginger or ginger-based products to mitigate the risk of nausea. I think while you're on chemotherapy, it is good to eat freshly prepared food, fresh food, minimize some preserved processed foods. Small but frequent meals will be a good strategy to mitigate any nausea or changes in appetite. And as with everybody, I think it is good to remain well hydrated. This would help in the tolerance of chemotherapy and to flush any toxins out of the body more readily. You are what you eat. It may actually sound cliched to many people, but recent research shows that it is far from being cliched. Everyone's diet, in the form of a pyramid, should be heavy on fruits, vegetables, and red meats, particularly, should be taken in moderation. I think this holds true also for cancer patients or patients who are in remission. And particularly, we know that certain cancers, for example, bowel cancers, are associated with excessive amounts of red meat, particularly barbecued red meats. And certain cancers, like stomach cancers and nasopharynx cancers, are associated with preserved salted foods. So I think in these groups of patients, perhaps there should be particular attention to reduce the amount of red meats in the diet and increase the amount of fish and vegetables and fruits. I think it's crystal clear now that smoking is a causative agent in lung cancer. In terms of chemicals, I think it's prudent to minimize exposure to synthetic toxic substances, be it products that we use in our body, like talcum powder, or even certain herbicides and insecticides are now implicated in certain studies to cause cancer. So I think we should be aware and avoid the use of these or minimize the use of these compounds when we are able to make the decision to. Please consult your doctor if you have any further queries.